abnormal behavior like overtly restlessness, hyperactive people. So these are all facets of mental health disorders in children. Likewise, in the elderly, I mean, the people who are 60, 65 and above are also prone to mental health disorders. For example, Alzheimer's disorders, where you have disorders of the memory that may also affect the personality and behavior. And of course, women too are vulnerable to mental health disorders because of the various stress they encounter in their daily chores and being a mother, a wife, a professional, so many societal roles that women go through.
Okay, and so if all of us are exposed to mental health issues, how do we go about prevention in cases where we can?
Yes, ability to acquire stress management techniques, because in this environment we're inundated with various forms of stressors. And if you don't know how to manage this stress, they may affect the individual productivity and efficiency, not only at work, but also at home. And that's why I said mental health is all about being productive, being able to contribute to your community, being able to achieve your full potential, interact appropriately with people around you, and also to be satisfied with yourself. So when behavior of an individual changes, the person may not have an insight that the behavior has changed. So close people to that individual will say, oh, you have lost weight recently, what is the problem? Or you're not as cheerful as you used to be. So people will try to tell you that there's something wrong with you. Because the individual does not have an insight about what's going on, he may not recognize these disorders. And also, like I said, unfortunately, family members don't recognize this condition. And when they do recognize, the social stigma that is attached to the psychiatric hospital sometimes prevent people from going there to look for help.
Yes, because I think that is a big issue. When you talk about the Federal Neuropsychiatric Hospital, for instance, Yaba, once you mention Yaba, people are like, oh, I don't want to go there.
Yes, that's why we're trying to sensitize Lagosians that apart from Yaba, there are other areas where you can get mental health services. For example, the Lagos State University Teaching Hospital, we have a Department of Mental Health. The same in LUF, Lagos University Teaching Hospital. We have mental health experts in General Hospital Lagos, General Hospital Bagada. And we're trying hard to also establish mental health care community services in all local governments in Lagos State. But at the moment, apart from Yaba, those places, including military hospital, Yaba, you can get mental health services from mental health experts.
Okay, and then people should know that it's not, once you have maybe signs, it doesn't mean that you're already, going crazy. Maybe they should also understand that part, and for the society at large, that if anybody is going to the Federal Neuropsychiatric Hospital, for instance, it doesn't mean that the person has gone, haywire.
Yeah, the mental health services is broad-based. You have those with mild, with moderate, but unfortunately the people that we see on the street that give the mental health issues badly, very, very few percentage of people mental health.
Perhaps those people won't even get to that level if they seek medical help.
Yeah, they have community services provided for them. So that's why we must, like I said, provide community mental health services. We must have policies, both national and state policies as regards mental health. Okay. Invest in mental health personnel.
Investment is very, very
also
important.
provide funding for mental health.
Okay, maybe we'll just go on a quick break, and then when we come back, we'll be talking more about mental health and take some of the questions and comments you sent in. Just stay with us on Health Matters.